Today we're going to present a clinical overview of the VelaShape III. We'll be discussing the legacy of the VelaShape and the technology behind VelaShape III. We'll also review physiology and discuss how VelaShape III improves cellulite and affects circumferential reduction. And finally, we'll review all the protocols that can be applied using the new VelaShape III device. It's worth pausing to reflect that Syneron has been at the forefront of body shaping for nearly a decade now. 8,000 units have been sold, 10,000 procedures are performed each day, and 5 million patients worldwide have undergone treatments with the VelaShape technology. This level of experience is really unparalleled and has allowed for the improvements you will see in VelaShape III. We know that the right temperature for the right amount of time in the tissue is what gives us results. We can now reach those temperatures and comfortably maintain them across all impedance ranges. In 2005, VelaSmooth was launched with clearance for cellulite, and in 2007, VelaShape was the first device to be cleared for circumferential reduction. Over the ensuing years, more power was added to the device until in 2013, we had 150 watts of peak power delivered with an intelligence feedback system based on impedance monitoring, additional clearance for circumferential reduction of the abdomen, and a number of different protocols to improve results. Let's talk about features specific to VelaShape III. Impedance monitoring and adjustable energy delivery provides a closed loop of energy with up to 150 watts of peak power. This allows us to reach the endpoint in the tissue very fast, generally in under 2 minutes, and this allows us to spend more time maintaining temperature, which is what gives us our results. Adjustable delivery also allows us to better treat non-responders. Impedance levels vary from patient to patient depending upon intrinsic skin qualities, hydration, and tissue composition, such as the relative proportion of muscle and fatty tissue. Previously, the challenge was to heat patients with higher impedances to the level desired. Sometimes it was difficult to reach temperature, let alone maintain it. Conversely, a very low impedance would also heat too quickly, and perhaps a patient may not tolerate the procedure comfortably, making the critical phase of maintenance difficult. These are no longer issues with intelligent feedback and 150 watts of peak power. Our studies show 100% response in all patients seeking circumferential reduction, at a minimum of 1.5 centimeters in the abdomen and an average of 2.6 centimeters achievable after a single session treatment. Treatments are also much more comfortable with the new electrode design, which is nicely curved and flush against the skin. We can treat a variety of conditions more effectively with these two applicators, the V-Contour and the V-Smooth applicator. There are 3 different cover sizes, small, medium, and large, for the V-Contour applicator, which comes packaged as you see. The small cover is for small focal zones like the submental region, while the medium cover is the mainstay cover for circumferential reduction. The large cover is used in the deep mode protocol to provide intensive heating for localized areas, and it is used in combination with the medium cover. We'll review that protocol further along in the presentation. The V-Smooth applicator for cellulite improvement has the traditional cover with rollers, but now has the benefit of closed-loop RF feedback and up to 150 watts of peak power, allowing for very rapid heating and much more efficient temperature maintenance. Built-in temperature sensors on the applicators allow for more comfortable real-time monitoring of tissue temperature. Now, what does all this mean in terms of results? It's important to keep in mind where we are treating and what we are trying to achieve to put it all in perspective. VelaShape III uses ELOS technology, or the combination between bipolar radiofrequency, infrared light, and mechanical manipulation with pulsed vacuum and rollers for cellulite and circumferential reduction. The synergistic effect of these modalities allows for controlled thermal injury in the dermis and hypodermis. In the dermis, controlled thermal injury improves collagen, and in the hypodermis, the effect is on the connective tissue and the adipose tissue. The ability to treat at a variety of depths is what continues to make the Vela technology unique, because it has a significant effect on cellulite, skin laxity and tissue quality, as well as the ability to reduce volume. Deep heating improves adipocyte metabolism, and this affects adipocyte volume. Here, you can see deep heating by radiofrequency and infrared energy into the tissue, affecting both the connective tissue layer by forming new collagen and stimulating fibroblast activity. Pulsed vacuum increases penetration depth and augments circulation. Both vacuum and rollers are effective in draining the lymphatic fluids. This H&E stain demonstrates the effect of RF and infrared heating. Here you see an obvious increase in the cellular components of the extracellular matrix and increased composition of collagen fibers, leading to a condensation of the papillary dermis and the deeper reticular dermis, with more organized and condensed collagen bundles. The result is skin with a smooth and healthy appearance. Pulsed vacuum further potentiates neocollagenesis via mechanical stress imposed on dermal fibroblasts. Vacuum allows for deeper penetration of energy into the tissue, and vacuum, via the negative pressure or suction it exerts, opens up compressed blood vessels and improves circulation. Improved circulation is crucial to the treatment of cellulite, but it is also very important to the improvement of metabolism of the adipocyte. Better circulation and more oxygen delivery to the fat cell improves metabolic reactions within the cell, ultimately reducing the size of the adipocyte. Heat further potentiates oxygen delivery to the adipocytes. This table illustrates that as water is heated, oxygen that is dissolved in that water has less viscosity. It becomes far more ready to dissociate from the water that it is carried in. In the case of VelaShape III, the oxygen that is carried is in the blood, and when the blood is heated, the oxygen in the blood is more ready to diffuse into the surrounding tissues, including the adipocytes. So, as you can see, each of these modalities, radiofrequency, infrared light, vacuum, and rollers, work separately and also synergistically to give us our overall result. The heat energy modalities give us the controlled thermal injury we need for neocollagenesis and improvement of the dermis and the underlying connective tissue structures. Heat and vacuum both improve circulation, and heat further augments oxygen diffusion and diffusion of other nutrients into the adipocyte. This improves adipocyte metabolism, which leads to lipolysis or the breakdown of fat into fatty acids and glycerol. The fat cells diminish in size. This smaller size improves total circumferential volume, and in cellulite decreases the volume of the chambers of adipocytes, as you will see in the following illustration. This reduction of tension on the fibrous septae reduces the dimpling effect. And finally, reaching appropriate threshold temperatures of 43 to 45 degrees in the adipose tissue and maintaining those temperatures over the correct amounts of time damages a percentage of the adipocytes themselves, leading to further reduction in circumferential volume. This is an illustration of the effect of the VelaShape technology on cellulite. Cellulite has many influential factors, such as age, hormonal status, diet, etc., but it's foremost a disorder of circulation. With poor circulation, adipocytes become sluggish and enlarged, creating increased volume in compartments with limited space. Fibrous septae are firm, and skin dimples from the tension. Blood vessels and lymphatics are further compressed, and now there is accumulation of intracellular fluids and physiological waste, turning the process into a vicious cycle. When we improve circulation and drainage, we improve adipocyte metabolism via improved circulation and oxygenation. This, in combination with a thicker, more organized dermal structure, gives us the improvement in cellulite and skin texture we are looking for. Now, let's discuss how we apply this physiology to our patients. There is a huge market potential, with over 90% of women saying that they would like to change their body appearance, but patients must be selected properly for best results. VelaShape III is indicated in the U.S. for temporary reduction in the abdomen and thighs, temporary reduction in the appearance of cellulite, improvement of circulation, and the relief of minor aches and muscle spasms. VelaShape III is CE marked for non-invasive body contouring via the temporary reduction of cellulite and circumference. Let's start with patient selection of cellulite. Who are the best candidates for cellulite treatments? Cellulite can be treated in patients of all skin types, making sure that they have realistic expectations. Be sure that the patient is not frankly obese and that there is not excessively loose skin. There should not be severe varicosities, and the patient will do better by leading a healthy lifestyle. Cellulite can be classified into a variety of classes. Mild to moderate cellulite, or class 1 and 2 cellulite, which is visible only when pinched or standing, will respond best. Class 3 cellulite, nodular or hard cellulite, which is the kind often seen on athletic body builds, will be more challenging, and patients should be advised and treated appropriately. The fibrous connective tissue in these patients is often calcified and can also be deeply anchored to underlying muscle fascia. It may be difficult to have some of these patients respond. However, some may respond with further treatments or a more aggressive maintenance schedule. In general, for VelaShape III, a good candidate will have subcutaneous fat bulges, the desire for regional volume loss, generally healthy skin, and realistic expectations and commitments to the treatment plan. We need to be aware of how much of the skin we'd like to treat for improvement in the skin tone and texture versus how much of the fat that needs to be treated. We also need to be aware of how large our target surface area is, because this will determine how long the treatment sessions are. And we will also need to estimate the desired reduction endpoint for the patient and how many treatment sessions will be needed to achieve that endpoint. When selecting candidates, the patient on the left has the need for a regional volume loss or circumferential reduction. This is a good patient. The second patient is a rather thin patient, but may need or may desire some targeted sculpting, perhaps in the flanks area, or some improvement or maintenance of her skin tone and texture. The third patient is a good candidate for circumferential reduction and post-baby skin laxity. The last patient, however, is a patient with a significant amount of visceral fat and a significant amount of reduction, and is not necessarily the best candidate. These are some pictures of further acceptable patients. On the left is a patient with moderate cellulite. In the center, a patient who would benefit from localized reduction and improvement of skin laxity. And on the right, a patient with predominantly subcutaneous fat. Be sure to avoid patients who are too thin or with body dysmorphia, patients who are obese, patients with excessive skin laxity, and patients with excessive visceral fat, as illustrated on the right. Now let's discuss treatment preparation. It's important to align expectations. Make sure the patient understands that this is improvement and not necessarily elimination. The results may be temporary, and maintenance is very important. That skin laxity improvement can occur with radiofrequency, but it is not the answer for excessively loose skin. That stretch marks also may improve, but not always, and that diet and exercise may also improve results, although are not essential. Make sure also that patients realize that weight gain may worsen results. Once indications and expectations have been reviewed, be sure to review contraindications before proceeding. Syneron does not recommend treatment of patients with pacemakers or internal defibrillators or any metal implants in the treatment area. We also do not recommend treatment of patients with a current history of cancer or patients who have not been cancer-free for at least 5 years. No severe cardiac disorders, pregnancy and nursing are contraindications, as are severe concurrent health conditions, an impaired immune system, or diseases which may be stimulated by light or heat. Additional contraindications include any active conditions in the treatment area, such as open wounds, psoriasis, eczema, and rash, or very dry and fragile skin, history of bleeding coagulopathies or active use of anticoagulants, severe thyroid or significant lymphatic drainage issues, any surgical procedures in the treatment area within the last 3 months, or treatment over tattoos and permanent makeup. It's advisable to work on clean skin. Define the treatment area of the patient while the patient is standing. Make sure to draw out the area, then weigh the patient and photograph areas. Measure circumference at 3 different points. Position the patient optimally so that you have the right amount of tissue to work with, but that your tissue surface is reasonably flat to ensure proper electrode contact. Apply a thin but visible layer of spray and set parameters. This is an example of the amount of spray you will want to apply. Be aware that you will need to reapply spray throughout the procedures to make sure the patient is comfortable and the applicator glides easily. Note that VelaSpray is rich with ingredients that are also beneficial to tissue metabolism, such as carnitine and caffeine. Set parameters either on the touch screen or the handpiece. Temperature readings can also be obtained directly on the handpiece. Remember, your target skin temperature is 43 to 45 degrees. Note that you will be able to see the time elapsed in the lower left corner, and this time can be zeroed by pressing and holding the clock. Just before beginning, take a moment to explain the procedure to the patient and enlist the patient's help in providing feedback. Talk to the patient throughout the procedure and make sure the patient knows to expect a heat sensation, but also that they should not be excessively or uncomfortably hot. Let them know that you need them to tell you when they are feeling a very deep warmth to avoid reaching an uncomfortable level. One way to do this is to use a scale of 1 to 5, where 1 is a very mild heat sensation and 5 is extremely uncomfortable. Ask the patient to let you know when the heat is at a level 3. This will allow you to understand the patient's tolerance, measure temperatures at the appropriate times, and optimize your settings. But most importantly, it will allow you to move your applicator when necessary before the patient reaches a point of discomfort. Now let's review the treatment protocols. VelaShape III is a very versatile and multifaceted tool for body shaping. With the V-Contour applicator, recall that you have 3 different size covers. The medium cover is used for circumferential reduction. The large cover, in combination with the medium cover, is used for the deep mode protocol, which is localized fat deposits. And the small cover is used for submental contouring. The V-Smooth applicator is the traditional cellulite applicator and is used for cellulite reduction. And combination treatments, such as the one described in the deep mode, can be used for localized fat deposits using both the large cover and medium cover of the V-Contour applicator, and treatments of the thigh that involve cellulite as well as localized fat deposits will require a combination of the large cover and the V-Contour applicator, followed by the V-Smooth applicator for cellulite reduction. Let's talk about the protocol for circumference reduction treatment. The circumferential reduction treatment protocol using the V-Contour applicator and the medium cover can be used to treat focal areas and well-defined areas, or it can be used to treat all the way around the abdomen or all the way around the thigh in a 360-degree fashion. It can be adjusted for different areas of the body. You will use a variety of area templates depending on the patient's body size and body habitus. You may mark out a large area template, which will involve 20 squares, a medium template, which will involve 12 squares, or a small template involving 8 squares. You can see here how one area is marked out, and in this particular patient, the large template is used. Define and mark all the areas. Doing so while standing is preferable, but be sure the markings are still easy to follow with the applicator once the patient is lying down. It will be important to avoid any bony areas, especially when there is insufficient tissue over the area, and very important to maintain full contact of the electrodes at all times. So recheck your markings once the patient is in position. In this thin patient, a large area template of 20 squares is used to treat across the entire abdomen anteriorly. In patients with more volume, you may decide to divide the abdomen into 2 parts and use the medium or small templates to heat areas of 8 to 12 squares on either side of the umbilicus. Remember, more adipose tissue will result in higher impedance and will take longer to heat. So in these cases, working with slightly smaller areas for optimal heating will be easier. Also note that you will need to be flexible with your areas depending upon the body morphology. You may have 8 placements in a perfect rectangle, or you may need to adjust the area shape to avoid the hip or ribs, for example. For circumference reduction using the medium cover, remember to turn the IR off. Start the radio frequency at 3 and keep it as high as possible throughout the treatment. If the patient is initially uncomfortable with the RF at 3, add more spray and continue. If the patient is still uncomfortable, then you may turn the RF to 2 and return to stacking. You may find that once the patient becomes accustomed to the heat, in many cases, you will be able to again increase the RF back to 3. The goal is to keep the RF at 3 for as long as possible, providing the patient is comfortable. Spray may help with this, as will fewer stacked pulses as the treatment progresses, or even a single pulse in the maintenance phase. Start the vacuum at level 1. You may decide to maintain the vacuum at level 1 in the first treatment, or you may increase the vacuum, depending on patient's tolerance. But be aware that you should not increase the vacuum beyond level 1 on lax tissue. Here is an example of the protocol as you will find it in the quick reference guide. Note that cycle 1 is the phase where you will stack to concentrate and drive heat into the tissue. This protocol begins with 5 stacked pulses per segment. You will stack 5 stacked pulses per each segment, and then 4, and then 3, and then 2. You will maintain 2 stacked pulses per segment until you reach the endpoint temperature of 43 to 45 degrees. You will do this in a horizontal snaking fashion. Remember, your IR is off, your RF is at 3, and your vacuum is generally at 1. If you need to apply more spray, do this in order to maintain the RF at 3. And if you need to reduce the RF for patient comfort, reduce it to 2, bringing it back up to 3 if the patient can tolerate it at a later phase. Once you have achieved temperature endpoint for the very first time, consider that you have reached temperature endpoint and move on to cycle 2 and cycle 3, which are the maintenance phases of the temperature endpoint. Cycle 2, you will change from horizontal snake direction to a vertical snake direction, and you will begin with 2 stacked pulses maintained in each area. If the patient cannot tolerate 2 stacked pulses, you may move to a single pulse. You will want to continue cycle 2 for 5 minutes if possible, or until temperature is reached. You will move to cycle 3, and again change your direction back to horizontal snake. You will again stack 2 pulses in each area until the temperature is reached, and you will continue this for another 5 minutes, if possible, at 2 stacked pulses. If the patient is uncomfortable, you may need to move after every pulse. In terms of total duration, cycle 1, when done properly, generally takes, in most patients, approximately 2 minutes. Keeping that in mind, we should try to have the entire circumferential mode protocol approximately 15 minutes in duration. It should be no less than 10 minutes in duration in the maintenance phase. Ideally, maintenance phase of 15 minutes will give you good results. A word about horizontal snake and vertical snake movement patterns. You will start cycle 1 in the horizontal snake pattern. After you reach temperature for the first time, you will move to the vertical snake pattern. Remember that movement of the applicator is also based on the anatomy of the patient. So keep in mind it's important to maintain contact over all curved areas. Adjust your movement pattern accordingly. This slide is an example of how you may decide to mark out the treatment areas on a given patient who you are treating for abdominal circumference reduction. In this particular patient, you see that the anterior abdomen is marked using a large template or 20 squares in the center of the abdomen with 2 small areas on either side. The posterior abdomen, or the flanks, are done with 2 medium templates. Note that you can adjust these sizes, again, depending upon the patient's size and the patient's body morphology. Again, if you have a large patient with a large BMI, it may be easier to heat the patient, dividing the anterior abdomen into 2 medium sections. Let's review the protocol. Again, cycle 1. You will begin stacking with 5 stacked pulses in each sub-area. Once you have done that in each sub-area, you will move on to a second pass with 4 stacked pulses in each sub-area. That pass will be followed by a third pass with 3 stacked pulses in each sub-area, and then finally 2 stacked pulses in each sub-area. You will maintain this, continuing with 2 pulses in each area until goal temperature is reached. Again, reapply spray as you need to, and if you need to move your RF from 3 to 2 because of patient tolerance, go ahead and do that. Once the temperature is reached, make sure that you continue the maintenance phase. The total protocol should last at a minimum of 10 minutes. Note that in cycle 1, pulse stacking occurs on the abdomen with 5 stacked pulses per area in a horizontal snake fashion. Again, remember, cycle 2 and cycle 3 are your maintenance phases. In cycle 2, you will continue stacking. You will continue stacking with 2 pulses in each area until goal temperature is reached. Once the temperature is reached, make sure that cycle 2 lasts for at least 5 minutes. If you need to reduce the RF from 3 to 2 in order to do this, you may go ahead and do so. If you can keep the RF at 3 and reduce the stacks from 2 pulses to a simple single pulse, go ahead and do so. But continue cycle 2 for 5 minutes. Here is an example of cycle 2 maintenance. For cycle 3, continue in the horizontal snake pattern with 2 pulses as tolerated until the treatment endpoint temperature is reached in the area. Remember, time and temperature are key. Achieve a temperature of 43 to 45 degrees centigrade and maintain that temperature for a minimum of 10 minutes. This is an example of how you may lay out your areas for treating thigh circumference. Again, the area sizes that are used and the areas that are covered will depend upon the patient's size, body habitus, and the areas desired to be treated. This is an example of pulse stacking on the thigh. Again, with an initial 5 stacked pulses in a horizontal snake fashion. This is an example of a patient result 2 weeks post a single treatment using the protocol for circumferential reduction of the abdomen. In this patient, you see a 3 centimeter abdominal reduction at 2 weeks. In this next slide, 2 weeks post one treatment, you see a 2 centimeter reduction. And finally, in this last slide, you see a 4 centimeter reduction in this patient 4 weeks post a single treatment session. It should be noted that results are visible 2 weeks after a treatment session, but optimal results are visible at 8 to 10 weeks. It is also recommended that maintenance sessions be carried out at approximately 10 to 12 weeks. Now let's review the deep mode treatment for localized fat. The deep mode clinical protocol is developed for optimized treatment of localized fat deposits. The protocol is designed for sustained deep heating of the tissue. The area in this treatment protocol will consist of 9 squares. It will be a 15 by 15 area. Select the body zone where the localized fat exists to be treated. Divide the area into zones of 15 by 15 centimeters, which will be approximately 9 segments. You will use the large cover of the V-Contour applicator for cycle 1 of this protocol. The protocol has 2 cycles. The first cycle is with the large cover. The second cycle is with the medium cover. Apply a thin but visible layer of VelaSpray at the beginning of each step of the cycle. This is an example of some of the zones in the body where you may desire to apply the deep mode protocol: the sides, the flanks, or the saddlebags. This is what the deep mode protocol looks like in the quick reference guide. Note that this protocol is with the V-Contour Applicator's large cover in combination with the medium cover. In cycle 1, where the large cover is used, the IR and vacuum are turned off. In cycle 2, where the medium cover is used, the vacuum is turned back on, but the IR remains off. Let's start with cycle 1. Cycle 1, to repeat, is with the large cover of the V-Contour Applicator. The IR is off, the vacuum is off, and the RF is started at 3 and moved to 2 when necessary for patient tolerance. You will not hear pulsing from the vacuum while using the large cover, so remember to listen for the auditory cues. You will start by stacking 4 pulses over a segment, and you will continue this in a horizontal snake fashion until the entire 15 by 15 area is covered. Once you have done 4 stacked pulses, you will move to 3 stacked pulses, and then 2 stacked pulses. You will apply 2 stacked pulses per segment for 2 full minutes. Once this is complete, you will use 1 stacked pulse per segment until you have reached a total of 5 full minutes of treatment of cycle 1. This will all be done in the horizontal snake fashion. Cycle 1 will continue by changing the direction from horizontal snake to vertical snake. In this second portion of cycle 1, you may reduce the RF from 3 to 2 if desired. Start with 2 stacked pulses per segment and move to 1 pulse per segment until another 5 full minutes has gone by. Once this second 5 full minutes is complete, you will have completed the second step of cycle 1. The third and final step of cycle 1 consists of turning the applicator direction back into the horizontal snake fashion. You will stack 2 pulses per segment and then move to 1 pulse per segment for a final 5 minutes of treatment. So note that you will be treating for a total of 15 minutes. In the first 5 minutes, you will be arriving at temperature and stacking from 4 to 3 to 2 to 1. And in the second and third 5 minutes, you will be stacking 2 to 1. Reapply VelaSpray frequently as needed for patient comfort, as the heat is very deep in this protocol. Once you have completed cycle 1 with the large cover, you will change covers to the medium cover and begin cycle 2. In that same area, you will treat again, this time with the vacuum on 1, the RF on 3 or 2, depending on the patient's tolerance, and the IR still off. Start with 4 stacked pulses per segment. Once you have passed 4 times, use 3 stacked pulses per segment, then 2 stacked pulses per segment for a full 2 minutes. Adjusting the RF to patient tolerance and applying spray for comfort. Once these 2 minutes has gone by, you will move from 2 stacked pulses to a single pulse. And you will continue to pulse in that area until a full 5 minutes has elapsed. Once this first 5 minutes has elapsed, you will change direction from horizontal snake to vertical snake, and you will begin with 2 stacked pulses per segment, changing over to 1 stacked pulse per segment until another 5 minutes has elapsed. And finally, the final step of cycle 2 is another 5 minutes of treatment, beginning with 2 stacked pulses per segment, moving to 1 stacked pulse per segment, until that third 5 minutes has elapsed. That means that you will be treating with the large cover for a total of 15 minutes and the medium cover for a total of 15 minutes. This is the deep mode protocol for localized reduction of volume. In this slide, you will see an illustration of the deep mode protocol using the large cover. Notice the auditory cues are different from what you are used to with the medium cover.
So she holds it? Yeah.
Once you've completed cycle 1 with the large cover, you will change covers to the medium cover and continue the deep mode protocol in cycle 2. Here are examples of what can be accomplished with the deep mode protocol. On the left, you see the flank at baseline. On the right, you see only the right side has been treated. This is after one single treatment, approximately 4 weeks after the treatment. There's another patient also treated on the side. Now we'll discuss the protocol with the small cover for small area treatments. Small cover can be used as an off-label treatment to treat smaller areas, particularly the submental area or the arm area. When marking the submental area, be sure that you have marked it in 2 lines. These areas are further subdivided so that you have, for example, in this area, a total of 16 placements, 8 in the top row and 8 in the bottom row. The treatment protocol for small areas, or submental region, is also accomplished with the IR off. In this case, you will begin with the RF much lower. You may begin with an RF of 1 or 2. The vacuum should be left at 1. Apply, again, a thin but lightly visible layer of Vela spray at the beginning of each cycle and reapply as often as necessary. This is the treatment protocol of small areas using the small cover that you will find in the quick reference guide. You will note that the treatment is divided into 2 cycles. Cycle 1 consists of multiple passes. The first pass is with 5 stacked pulses per segment, the second pass at 4 stacked pulses per segment, the third 3 stacked pulses, and the fourth 2 stacked pulses per segment until the temperature is reached at 43 to 45 degrees. You may choose to wait 3 to 5 minutes between cycles to reapply cycle 2. Cycle 2 is performed exactly as cycle 1. If the patient is tolerating the cycles, you may choose to go directly from cycle 1 to cycle 2. This is an example of the treatment of the submental area with a small cover. Be sure to make sure that the applicator tip is in full contact and that you avoid bone and the thyroid. Here's an example of what can be achieved with this protocol using the small cover. This is a patient 8 weeks post 3 treatments, courtesy of Dr. James Houghton. In this next section, we'll review the cellulite reduction treatment protocol. The cellulite reduction treatment area is generally the thigh area. This is an example of how you will mark out the thigh area. Each area that you choose to treat in the thigh will be approximately 20 by 30 centimeters. You will mark out 2 circles, as illustrated here, and 2 ellipses, as illustrated, on any 20 by 30 area that you wish to treat. This next slide illustrates an example of what that would look like on the thigh. This is a 20 by 30 centimeter treatment area with 2 circles marked out as such and 2 ellipses on either side. What you will be doing here is first treating over the 2 circular areas. the applicator will be placed on one circle, and you will move the applicator in a clockwise fashion, gliding it with the parameters set and the heat being delivered until the patient reaches temperature. You will then pick up and move the applicator to the second circle and repeat the same function. That is, gliding the applicator in a circular fashion over that circle until the temperature endpoint is reached. Once the two circles have reached temperature endpoint, you will do the same thing with the ellipses on either side. And once the ellipses have reached temperature endpoint, you will have reached temperature endpoint in all four circle and ellipses in that 20 by 30 centimeter area, and you will hit the maintenance phase, which we will describe in the coming slides. To review, the cellulite reduction protocol appears as such in the quick reference guide. Cycle 1 and Cycle 2 involve reaching the temperature in the two circular areas. Again, you will place the applicator on the circular area and glide it in a clockwise fashion until your temperature endpoint is reached. Once it is reached in Circle A, you will move to Circle B and do the same. In Circle C and D, which are ellipses, you will move the applicator again in a clockwise fashion, gliding it until the temperature endpoint is reached. This will be Cycle 1, 2, 3, and 4 for all four of the circular and elliptical areas. Once those segments have all been heated to temperature, Cycles 5 and 6 involve the maintenance phase, and you will maintain the temperature moving in a horizontal snake-like fashion over the leg or in a vertical snake-like fashion in order to maintain the temperature. Each of these ideally are 5 minutes. Cycle 5, 5 minutes, and Cycle 6, 5 minutes. However, remember that the leg is a curved area, and in some patients it may be difficult to move in a horizontal snake-like fashion. If that's the case, continue to move the applicator in a method that's most comfortable while maintaining contact on the patient. In order to achieve the best clinical results, it's recommended that the total treatment duration for each sub-area, which is this 20 by 30 centimeter area, is a minimum of 15 minutes. Once you have completed one sub-area, you will move to the next sub-area, be it the posterior portion of the thigh or the lateral portion of the thigh, depending upon the size of the leg. You will continue to repeat the same protocol on that sub-area, and once that is completed, you will move to the final area. In some patients, you will find you will only have room for 2 sub-areas, and in others, you will have room for 3. Here is an example of the cellulite reduction technique. In this slide, the operator is heating the first circle in a gliding fashion, circular motion. To finish up, let's cover some tips and pearls. Remember, our goal is to define the tissue area we wish to improve and apply the correct protocol to that area. But in the end, it's really about getting that tissue to the right temperature and then maintaining that heat over time while keeping the patient comfortable. Think of temperature. The stacking will get you there, and in the cellulite protocol, it's the small area circles that will get you to temperature. Think of time. The 2-pulse stacking and the single pulse gliding will keep you there. When you are in any protocol's maintenance phase, the idea is to deliver optimal heat and keep moving your applicator. And finally, think of tolerance. Talk to your patient during the treatment to push the heating as far as you can without making the patient uncomfortable. Move the applicator when needed, even if you've not reached the final number of stacks you meant to deliver, if the patient is on the point of reaching their deep heating threshold. You will be back in that segment soon enough, and you will get that tissue segment to temperature in the next pass. Reapply spray as needed to keep the epidermis comfortable. Remember, once heated, adipose tissue holds heat very well. By cooling the epidermis with spray, you will not be cooling the deeper tissue. You will be keeping the epidermis and the patient comfortable. And finally, adjust your RF and vacuum parameters, and in the case of cellulite, also your IR parameters. Adjust them up and down as needed to optimize energy delivery while maintaining the patient in a zone that is tolerable for them. Treatment intervals for all treatment protocols are 3 treatments once every 2 weeks. You may decide to perform a single-session treatment for circumferential reduction or localized fat deposits for equally excellent results. If you choose the single-session treatment in a given patient, the method is to carry out the protocol as explained in the earlier slides, but repeating the entire protocol on the area that you are treating so that each area is treated twice. You will be nearly doubling the treatment time for that patient for that session, but this will be a single-session treatment. One of the great advantages of the VelaShape III for the operator is the comfort and ease of doing the treatment. Use the foot pedal. Some of our trainers prefer to stand on the pedal without shoes so that they can feel the pedal more easily. Hold the applicator in a way that's most comfortable for you. The way shown above is one way to be comfortable and close to the patient's skin, allowing for increased perception of applicator contact to the tissue. While treating the submental area, you may choose to hold the applicator handle and use the trigger on the handpiece instead of the foot pedal. Patient positioning is extremely important. You need to be sure that you are working on as flat a surface as possible in order to keep applicator contact. However, you also want to be sure that you have as much tissue as possible available to you so that the patient is comfortable. This is an example of how you may wish to position a patient while working on the side. This patient is lying on her back with a roll towel under her flank to bring forward tissue from the side and flatten the work area. In this patient, we decided to divide the abdomen in 2 parts and treat half with a medium template from the umbilicus to the side for the circumferential reduction treatment. In this same patient, she was then turned and positioned onto her abdomen with a roll towel to expose an optimal flank and side area. This brings some tissue forward so that we have enough tissue overlying bone and she can be treated comfortably. In some situations, you may be able to move the operator table so that the patient table is actually adjustable and the patient is slightly in the sitting position. And some operators have actually chosen to sit the patient in certain situations. And let's finalize with a few points on maintenance. Be sure you refer to the user manual and read the manual carefully before beginning treatments. This is what the setup of the VelaShape III should look like. You notice there's an V-contour applicator on the left side of the device and a V-smooth applicator on the right side of the device. Be sure the arms of the device are equipped with a rubber stop to keep applicators securely in place when hung. Also be sure all connections to the ports in the back are secure. Note, your foot pedal plug needs to be securely attached. Make certain the cuff is turned and securely connected, and be certain the foot pedal cord is not kinked or stepped on during treatment. When inserting the applicator hose or the umbilical connection, be certain that the pins are correctly aligned. Check your filter cup and be certain the filter is cleaned at least once per month. For frequently used devices, you may need to check more often. Before each treatment, be sure to check the treatment covers to make sure that the O-ring is securely attached and the electrodes are in place. Proper filter maintenance is also very important to the correct functioning of the vacuum. During the treatment, be sure to replace the filter every 30 minutes. This is why there are a number of filters included with each cover. You can wash the filters at the end of the treatment with warm water, dry them thoroughly, and reuse them in subsequent sessions. If during the treatment the suction or vacuum seems diminished, check and/or replace the filter. Once the filter is removed, be sure to clean the recess under the filter area with tissue or a Q-tip. You will be reapplying spray, so be sure to wipe the lamp clean every few passes to maintain accuracy of thermometers and also to maintain and minimize the amount of VelaSpray accumulation. Please refer to the user manual for troubleshooting. If you encounter system error, You may desire to first check the system by completely turning the system off and then on again. For specific areas and symptoms, refer to the user manual. Thank you for joining us. We hope this has been informative, and we hope that you enjoy using your VelaShape III. Here are a number of frequently asked questions that we've encountered. Patients will ask, when should I expect to see results? You can expect to see results in the first 2 weeks with VelaShape III, but optimal results are noticed at 8 to 10 weeks after the treatment. People will also ask, is maintenance required? And yes, maintenance is required. We recommend maintenance at 10 to 12 weeks. Many ask, what is the difference between VelaShape II and VelaShape III? I hope we've covered some of the differences in the presentation, but I do want to emphasize that there's a major difference that's very important, and that is the doubling or more than doubling of the peak power between VelaShape II and VelaShape III. VelaShape III has 150 watts of peak power, and not only is the energy there, the device is actually equipped with an intelligent feedback system, which allows the energy to be delivered in a smart fashion so that it can be delivered across all impedance ranges. So major difference is that initially some non-responders with previous versions of VelaShape are now responders with VelaShape III because the impedance can be overcome and the energy can be appropriately delivered so that all patients can be heated. It allows us to heat the skin tissue to 43 to 45 degrees, which is so important in our ability to see results. And that tissue is heated very quickly, which in turn allows us to more efficiently maintain over time that tissue temperature. It's that reaching of the tissue and that maintenance phase that is so easily carried out with VelaShape III that allows us to see these improvements in results. And that follows the next question, is there a difference in patient outcome? There certainly is an improvement in patient outcome when VelaShape II and VelaShape III are compared. There is a segment of the population that can be a non-responder with VelaShape II, usually because of the difficulty in reaching temperature at certain impedance levels. With the impedance intelligent feedback system and the higher peak power of VelaShape III, that non-responder rate is eliminated. So all patients respond with VelaShape III, and that leads to an improved outcome. Also, it follows with the science that when patients are able to be treated to a certain temperature and that temperature can be comfortably maintained, what follows is physiologically just something that leads to good results. And finally, are the treatments comfortable? The treatments are comfortable. Now, patients should be aware that you will feel a deep warmth. Many patients find that quite soothing and quite comfortable, but this is something that patients should be aware of. Otherwise, the treatments are quite comfortable with VelaShape III, and this is a big advantage of this system over many other systems.